I told you, Mashav is Israel's national aid agency, and we have a movie for you. Fortunately for all of us, it's also only 1 minute and 40 seconds. And then the flow will be completely Michal's. 1 second, please. Ora is helping me here. And here we go.
Mashav, Israel's Agency for International Development Cooperation, was launched 60 years ago to share the know-how and technologies which provided the basis for Israel's own rapid development. Mashav aims to empower those living in poverty in a holistic and innovative way and support fellow nations and communities in their struggle to achieve sustainable development, placing people at the heart of its initiatives. Our agricultural programs use unique techniques and farming methods to increase sustainability, food security, and hunger eradication. We believe that investment in education is an investment in our future and an agent for change around the world. We coordinate Israel's official humanitarian assistance, building medical facilities and supplying medicine in the wake of earthquakes, floods, famine, and other disasters. Mashav promotes innovative entrepreneurship as a means of advancing growth and prosperity. We believe that gender equality and women's empowerment are central to reach sustainable development. Our philosophy is to leave no one behind. During 6 decades, Mashav has trained over 300,000 people from more than 140 countries and has established development projects worldwide. Mashav, Israel's Agency for International Development Cooperation, is celebrating 60 years of sharing its experience and partnering for a better world.
Okay. Michal, the floor is yours.
Thank you so much. Good afternoon, everyone. I'm going to share my screen for a second. Can you all see my screen? Mashav, people, can you tell me if my screen is seen? Yeah, perfect. Great. So good afternoon, everyone. My name is Michal. As was mentioned by Yoram, I'm the CEO of an organization called NALA. We'll speak a little bit about NALA in a second, but NALA is an organization that works on public health and specifically on a group of diseases called neglected tropical diseases, diseases that are perpetuated in conditions of poverty and lack of basic hygiene, sanitation hygiene. And I'll give you just a little bit of background by myself. I've been working in the development sector, in the nonprofit sector for the last 25 years. Been working for about 15 years in disaster response, with the last disaster response being during the Ebola crisis in West Africa. I worked for about 1.5 years in Liberia, and for the last, since 2015, so for the last 5 years, I've also managed the NALA organization. In the presentation, we're going to talk about a few things. First of all, just done a little bit of introduction, then we'll talk a little bit about WASH and health. I think that the COVID-19 in a way is a very strong, shows very strongly the linkage between WASH and health. And we'll talk a little bit about statistics of WASH and health anywhere in the world, and then kind of like zooming into neglected tropical diseases, looking at things that are done in neglected tropical diseases and lessons learned we can take from neglected tropical diseases into the COVID-19 response. And mainly one of the things that NALA has been specializing in is intersectoral coordination. We've created a policy, some policies together with the Ethiopian Federal Ministry of Health, and we'll look at those and look at how they could be then maybe what could we learn from it for COVID-19. We'll then talk a little bit specifically more on COVID-19. And at the end, I just want to share with you some helpful links so that if anything that was said here is interesting for you, you could just go and download those materials and use them wherever you are in the world. I've looked at your profiles, and it's a very interesting group. If it wasn't for Zoom, I think it would have been a wonderful collaborative discussion. And maybe during the questions we can get also some of your perspectives and on those topics of WASH, of working across sectors to promote disease prevention with WASH. So a little bit of about WASH. You know, every time you try to look into statistics about WASH, it's staggering. It is estimated about 2 billion people live with drink water that are fecally contaminated. 4.5 billion people, so more than half of the population of the world, use a sanitation system that doesn't protect either their family or the downstream communities, if we're talking about rivers. And one of the diseases that we're working on is bilharzia, schistosomiasis, where this is the main contamination way. And another thing that is staggering is saying that, you know, working on WASH could actually result in reduction of about 10% of the total disease prevalence. Again, you know, if I kind of like zoom in a little bit more into Ethiopia, for instance, then in Ethiopia, in Ethiopia, the 80% of the schools don't have primary schools don't have hand washing facilities, and around half of them lack latrines. You could understand what that means on child health and on their ability to develop without getting sick, without to develop both cognitively and physically, and become working adults. About 93% of the households lack latrines. But even with that, so that means I've put on the right side of the slide the sanitation letter. I think some of you are familiar with the sanitation letter. It looks at different levels and of where of sanitation access that you have around the world. So the data that you have on the sanitation letter on the right is actually the global data. Starting from people that have safely managed latrines in their households, and down to open defecation. When we talk about 93% of the households in Ethiopia lacking latrines, we're talking about them having either having latrines in a shared compound, or down to using open defecation. With that, saying that, it's also a very promising thing to see that there's a big change, a big step forward in Ethiopia with open defecation, where it increased from, it's not 80%, it's 8% in 2000 to 27% now. So still a long way to go, but things are changing for the better. I'll talk a little bit about where we go into it in NALA. So NALA is an organization that looks at breaking the poverty cycle by eradicating neglected tropical diseases and other diseases of poverty. And we're working towards eliminating the root causes and not only treating the symptoms or giving medications for people that are sick. We're working on neglected tropical diseases, and when we speak about neglected tropical diseases, I'll say a few words about them. So neglected tropical diseases are diseases, are a group of diseases that the World Health Organization has marked as diseases that do not get the right attention. Usually those diseases are no longer exist in the richer industrialized countries, and also in most cases they create disability and they don't kill, and therefore the statistics are not as bad. But those are the diseases that you find mainly in very, very impoverished communities. We're focusing not on 3 diseases: soil transmitted helminths, so intestinal parasites, schistosomiasis or bilharzia, that is perpetuated through contaminated bodies of water and rivers, and trachoma, which is an eye problem that is also perpetuated through environmental problems. It's a bacteria in the eye, but it is transmitted through flies and through and therefore open defecation and clean water and washing face with water is the main prevention. Just maybe a few words on how those diseases are being perpetuated. So when most of the communities where we find it are communities where you have a problem of poverty, of poor access to a basic wash. Because of this poor access, the environment is contaminated in those communities. People are exposed to infection, and that leads to disability, to medical costs, to stigma and to exclusion, and therefore deepens the cycle of poverty and creates more and more poverty, and again, cycle of contamination. So when we talk about risk factors, we speak about poverty, we speak about the environment, and therefore WASH is a big part of it, and behavior. And one of the things we're trying to do, and you'll see it in a second when we talk about integration and coordination, is to actually link the behavioral elements, the health elements, and the environmental health elements into one integrated approach. Maybe just to see, in Ethiopia you have about 900 districts. You can see the majority of the districts have the 3 diseases we're talking about: soil transmitted helminths, trachoma, and schistosomiasis. Prevention steps, you can see hand washing is one of the preventive steps. Using latrines works for all of those diseases, washing your face, and so on. And now I want to talk a little bit about, so how do you resolve it? So you want to create, you want hand washing. You want people to wash their hands. You want people to keep sanitation. Let's take hand washing. Hand washing is something that is relevant for also for COVID-19 and for NTDs. If we want to create an intervention that promotes hand washing, it's usually not just one sector that needs to work on it. You could have the health sector creating messaging, the water sector, education sector working on it in schools, working it in different education institutions. We usually bring together also the finance sector. They're the ones who fund all of it and so on. When we tried to work, when the Ethiopian Federal Ministry of Health decided that they want to now put a big focus on disease prevention and on hand washing, the question was, how do we do that? And the decision was to create a policy that brings all those sectors together and creates one holistic approach where those sectors can actually speak to each other. Together with the Ministry of Health, we created 2 main policies. One of them is a national framework to guide integrated programs in Ethiopia. And the other one is a ward level or district level toolkit that was created. Both of those toolkits are available on the Federal Ministry of Ethiopia website, and we've been in the last year and a half presenting them in many international forums. because Ethiopia is a pioneer in that sense, in kind of like creating a very structured framework to bring together those sectors. The idea of bringing those sectors together is to look into different ways of working together, and to create, and I'll show you in a second an example of how we can actually create added value by bringing those sectors together. And we've delineated the steps, where you first of all create a preparation initiation, then create a task force that is kind of like the leadership team, and a working group that works on this. You analyze and characterize the current situation, develop a work plan, implementation, and do joint monitoring and evaluation. A lot of time was also put into place into creating joint data and joint monitoring and evaluation. I'll show you in a second how the databases can help and kind of like create a joint language between the different sectors. So here's an example. This is a database of the South region in Ethiopia, and it pretty much looked at the disease prevalence of different diseases. What are the NTD partners and what are the WASH partners? The districts that are marked in red are districts where you have both sectors, and the ones in yellow have one of the sectors. And what we presented then to the local governments was, or to the regional governments, was pretty much an analysis of this, where I've put one of the slides here saying, okay, if we have both sectors in a district, and the district is high level, and all those, the red and the yellows are high prevalence in those diseases, then that means that there's a very easy opportunity. If those sectors work together, you can actually reduce the disease prevalence. And if you have, and the yellow ones are ones where you only have disease prevention sector working, then neglected tropical disease sector working, but not a WASH. So that's where you would want to prioritize new WASH programs, because there you have high diseases, but you don't have a real approach towards entities. I'm going to stop now for a second and see with Yom. Yom, do we have any questions so far?
There is one question that I think that we can raise now. A question by Mosa. He asked, how can people prevent themselves from these diseases who live in refugees and IDP camps? And it is, we can continue with more or less the same question. Again, from Mosa, he writes, the life is very hard in camp because all people who living in camp, they are using same sink and toilet and other, and drinking water. Yeah.
So maybe I would say one of the things I'm usually telling people in Israel when we talk about our work in Nala is sometimes it's very easy. Like, you know, when you talk about diseases we're working on, which is neglected tropical diseases, the answer is very simple. It's washing your hands and going to the toilet, not outside, but in kind of like safe latrines. That's it. Sounds very easy. You know, could probably prevent all diseases in those two simple actions. But then when it comes to what do we need to have in order to do those, then this becomes very, very, very complicated, because in order to wash your hands, you have to make sure that there is available water, clean water and soap in the environment. And we've seen the statistics in schools in Ethiopia. That's not the case in many of the schools. And in order to not go outside and go to a safe latrine, you have to have a safe latrine. Again, you know, not true about many rural and impoverished locations. So, so this would be on that. If we speak about the COVID-19 response, we also saw that as one of the big challenges. Hand washing stations. One of the things the Ethiopian government has started doing is they have trucks that kind of like go and deliver water to hand washing stations. So, for instance, we've put around 100 hand washing stations in central locations, and with the agreement with the municipalities, that the municipalities would then fill those stations on a regular basis a few times a day. Physical distancing in COVID-19 we found a bit more challenging. We know that masks have some important role in creating in limiting disease prevalence. So that's one of the things that we're working on and creating homemade masks. We're providing masks mainly to medical teams, but it's very hard to do it for the population. And then also with physical distancing, and we'll see some examples in the future, in a few minutes, not so far in the future, there are, like, we've identified a few key areas where we think that it's a challenge, and we try to come up with as many solutions as possible to those challenge areas, understanding that you have to be strategic about it. And I think that would also be true for refugee camps, in the sense that it's a very difficult environment to be working in, and putting very cheap hand washing stations and availing water tanks and so on. We've created pedal operated hand washing stations to also limit the contamination. So it's foot operated hand washing stations, and that would be one solution. And the other solution, and trying to limit as much as possible the contact. Another question?
Yeah, actually. How do you make sure that the maintenance or sustainability of hand washing
facilities
will work, and they want to just, they will stay there and be functional? And the other one asked regarding the possible connection between WASH and the food security. I don't know if you have something to say about that.
Okay, yeah. So let's start first of all with the first question. So sustainability is a big issue. Is a big issue in development as a whole. Specifically in COVID-19, we made sure to have a clear local owner. So that means if it's, for instance, we put hand washing stations in health centers. So there's a very clear person in the health center that is in charge of refilling the hand washing station. If it's in other central locations like junctions and so on and so forth, we usually made sure that there is for instance, in one place we worked with an NGO that works with street kids, kind of like made them the owners of the hand washing stations, and they kind of like they sustain it and so on. The only place where we had real challenge with maintaining the hand washing stations, and in some cases even with it disappearing, is we put it also in some central bus stations, and that has been difficult. First of all, the volume of people passing and using it is huge, so refilling is needed very often. And the second is in one of the things we make sure is when we build hand washing stations is there's a very clear owner, there's a very clear maintenance scheme, and also our team does routine checkups in the location. And if anyone is interested in the pedal operated hand washing station, in the last slide I put my email address. I'd be very happy to share the specs if it's helpful for anyone. But we've done that. And the other thing that we've done beyond coming and visiting and kind of like adjusting the ownership and so on after setting up the hand washing stations is we've also set aside some budget for changing, for fixing. So for instance, in smaller locations, we've put hand washing stations that have 60 liters and are kind of like more are smaller and lighter and so on. In Addis Ababa, in some of the health centers, the volume of people, and also in the bus stations, the volume of people was huge. So we've taken a very big water tank, and the frame was not able to support the water tank. The frame was getting a little bit dodgy and so on. So we could, with the funds that we set aside, we made sure to structure a much firmer frame to create an easier pedal for children to step on, because we saw that was also an issue in some of the hand washing stations in Addis Ababa and so on. So it's always important to, first of all, get the sustainability ahead of time, which I think many of the professionals here are very aware of that, and also retain some funds to adjust to the specific conditions of each and every location. The second question was about WASH and food security. Not sure if I'm able to answer that specifically, but WASH and nutrition are very much linked. I don't know if that image is wonderful, is exact, but for me, it's always like a bottle that, like a bucket that leaks if you have, for instance, intestinal parasites, and you cannot really digest the food and use the nutrients. Then you can pour water to the bucket, but if there's a big hole in the bottom, everything would just leak, and the bucket would never fill. So in that sense, for instance, in Ethiopia, the prime minister, the former prime minister, has created a declaration called the Sikota Declaration that focuses on ending undernutrition until 2030 in Ethiopia. And one of the main focuses there is on hand washing. So just teaching hand washing in order to prevent diarrheal diseases, which are first of all the leading cause for under 5 mortality in Ethiopia, and also one of the leading, I think it's either the first or the second leading disease in Ethiopia. I've seen kind of like popping up that there's a few more hands, so
there are lots of questions that asking about how can we make sure that sanitation and hygiene are okay when we have the scarcity of water. As I mentioned already before, the approach in Israel to the water issues, water management and everything, is that we're talking about a holistic approach. Everything is connected to everything. And during the next lectures, we will talk a lot about ways to have more water, ways to have sufficient water, and water that are suitable for either drinking or agriculture. There are two different things in a sense, and it's all connected. So when you have scarcity of water in it, even if refugee camps, there are some ways of tackling these issues. There are some technologies. Some of them are very expensive, but some of them are very simple and not so expensive. Like, for example, water purification. You can have huge machines that will purify lots of big amounts of water, but you can also have a filter that you fit to a bottle, and it's enough for you to have water that are not contaminated. This is one thing. And another question that I would like you to refer to, if possible briefly, because we're running out of time already, is relevant also for Israel. So I'm very curious about the answer. Benson Githua is asking, in most parts of Africa, not this one, sorry. The question was, regarding how do you make sure that social distancing is being kept in schools, and how do you make sure that kids are not affected. And it's very relevant for Israel because we just recently had one school with more than 100 kids that were that caught the COVID-19, and this is a big issue also in Israel.
Yeah. So yeah, can you hear me? So in Israel, if we speak about the education system, and the education system just started a few weeks ago to work in Israel. They've done a few things at the beginning with the education system. They've created a situation where you have different, like smaller groups that study in the class, so you can maintain better social distancing. They've created a situation where you either don't have breaks at all, or you have breaks in a very in a dedicated location, so that you can create as little as possible contamination. It is a challenge. It's a big challenge, but you're trying to create a situation where you minimize the contact. Having the masks again is seemed in Israel like a very important thing. What I might suggest is maybe at this point we'll continue a little bit more with a presentation, and then we'll see how many more answers we could get in the end. Maybe one last thing to say about the questions. We cannot get to a black and white, so in many cases you have to do the best you can to prevent. And to work around the circumstances you have to do what you can. Yoram was talking about using a lot of technologies. We're trying to minimize as much as possible the technologies we're using on the ground for the population, to make sure that they're scalable. The technologies usually work for the institutions, for the places where you don't need as many. But for the population, we try to go to the market and see what do we have. We have eucalyptus, you have corrugated iron sheet, you know, what are things we have, and how can we work with them to create locally based solutions, and solutions that that can easily be taken up by the local businesses, small scale businesses, and so on and so forth. But I'm going to take now a step back and go back to talk a little bit about the integrated approach and about coordination. And then at the end we can see.
Just remember that you have 20 more minutes.
Yeah, I'll try to buzz through these and then go back to questions. So let's talk a little bit about Nala and COVID-19. So when the first case of COVID-19 started, we've established daily calls with our teams in the different locations around Ethiopia, and identified a few goals for the intervention. One of them is raise awareness on prevention and symptoms. Second one was increase access to hand washing. Third was train community health workers. Fourth was provide health materials to hospitals and health centers. And the fifth was advocate to local leaders. The disease started appearing in Ethiopia in middle of March. We knew that we have ahead of us both Easter and the Ramadan period. It was very important for us. We knew from other places around the world that holidays are a big contamination time, and we wanted to make sure that we kind of like speak to local leaders, speak to the community, make sure health workers are going out to the community to talk to the community, but they're doing it in a safe way that doesn't jeopardize them. And so train them well, give them the right materials, and kind of like start running forward. We also looked and saw that when we speak about COVID started in the big cities. Usually we work in village areas. It meant that we needed to work on a different strategy, worked very hard on social media, and you can go to and see the materials, trying to, again, you know, going to the same message of trying to be very strategic. Think about what are the what are populations that have the hardest time, that are at the biggest risk, and trying to see how we create messaging for them. So if we see the elderly as a high-risk community or group, They might not be on social media, but their children might be on social media. So trying to make sure that we get to those, and that the messaging works on understanding what are the danger or at-risk area and approaching them. You could see here some of the examples. So, for instance, on the left, you could see one of the priests in Gondar in northern Ethiopia using the foot-operated hand-washing station. You could see that his foot is on the pedal, and that operates the faucet. About 2 weeks ago, we also designed another hand-washing station that has 2 pedals. So a little bit like in a car, you have one pedal that gets the water and one pedal that gets the soap. And so you actually have to touch nothing in order to wash your hands. We've also done very, very strong work with the churches and with the religious leaders, and you can see here like the markings of prayer spots for different believers to pray in the churchyard. And in order to reach out to rural areas, we went and we did a lot of messaging in the rural areas, talking about different locations and how do you work there. We've also identified a few at-risk areas. We spoke about public transport, for instance, being one. So one of the things that was done in Ethiopia is public transport was limited to half the amount of people in normal times. We've done a few campaigns in public transport stations where we've done, we went with alcohol and disinfected all the cars, but also use that not only to disinfect the cars, which we can do like a few times, but also to talk to the transporters, to put hand washing station, to get them to be enrolled into the safety of the population. We've spoken before about the coordination mechanisms we created on the federal level, on the regions, and in the district levels. So we also use those platforms to support COVID-19. So the fact that we have on the district level, so far we implemented the district level coordination mechanism in over 100 districts in Ethiopia. So in those districts, kind of like the health, the wash, the education, the finance, they're all sitting together, they're meeting together, they're planning together, and so on. It's then easy to transition this activity to work also on COVID-19, to say, okay, who do we need to approach? We need to approach families, we need to approach businesses, local businesses, we need to work on the health centers. What part does each of us take in this role? And we've seen that in many of the districts, even though it was not assigned by the government, the WASH NTD coordination sectors have actually taken on this role. I wanted to finish just with one quote from Ellen Johnson Sirleaf. She's the former president of Liberia. She was the one that was leading Liberia during the Ebola response. And I thought that that's something that is a bit inspiring. She was talking about the fact that when epidemics strike, fear, anxiety, and despair can be agonizing. But as we learned during the Liberia's Ebola epidemic, we are not defined by the conditions we face, no matter how hopeless they seem. We're defined by how we respond to them. Decisive political leadership and global cooperation, along with every single one of us playing our part, will determine if we win the war against this invisible enemy. And I think that for me, this is one of the main messages. And I think Muse has raised it and came up in the questions. Some of the conditions we're facing when working on disease prevention seem insurmountable. They seem impossible. And if we just look at them and try to resolve everything at the same time, get to an ideal situation, it's very hard. But thinking on our feet, trying different solutions, changing all the time, trying to see what solutions. One of the things one of the reasons you'd ask yourself, why would an Israeli organization even work on those things? One of the abilities to do those things, to see what are the technologies and what are the solutions that are happening in Israel, replicating a lot of things. One of the things we've done very strongly in the COVID response is Israel was started with the COVID response before Ethiopia. So let's see what tools can we take from here and adjust them to the Ethiopian structure. One example is, for instance, in Israel, one of the things that was seen is it might be harder to check for coronavirus. We might not have the logistics ability, and we might not have enough materials for the examinations. But one of the things we could follow, for instance, is the trend in respiratory diseases. If we see more complaints about respiratory diseases in a specific area, that means that's an area that we need to strategically go to and check for coronavirus. In Ethiopia, for instance, right now, you can see that the Addis Ababa is a big hub for COVID-19 response. There are areas in Ethiopia where you have some cases. There are areas that at this point you have no cases. One of the things we're doing with our health partners is we're monitoring respiratory diseases to know when do we have to work to move from prevention to mitigation. So that's also something to think about and to maybe take onwards. I've put here some helpful links for you guys. The World Health Organization created a global toolkit on disease prevention and working together on integration between the different sectors for prevention of hygiene-related diseases. In the Ministry of Health, you could see the two documents that I've showed at the beginning. One of them is the translation of the global toolkit to the federal level in Ethiopia, bringing all the NGO and the public partners together from the different sectors, as well as the district level toolkit, which is much more implementation based. How do I do it in every community? How do I implement it? How do I make sure that I prioritize well and that I make sure that with the scarce resources that I have, I direct them to the right direction. And then you could also see the NALA resources. They're all available. They're all open online. You can take them, you can change them. If we can help someone in anywhere else around the world, in India, anywhere else, in kind of like approaching the community in a little bit better way, then we've done our work. And at the bottom, you also have my email address. Feel free to drop me an email, and I'll try to see if I can provide more specific contextual answer, either myself or my team, the team of experts in NALA. With that, I'm going back to Yoam. Do we have time for more questions?
Yes, and actually we have one more question that I find very interesting and very kind of like looking for a practical answer. They're asking about ways to take care of health workers in the field. How do you make sure that they keep themselves safe?
So yeah, so this is a big question that we tackled. One of the things we've done, and again, you know, if you're interested in that and you wanna see it, just drop me an email. But we've created from the get-go an internal policy document for all of our workers to keep them safe, to make sure that that they are protected with masks, with hand sanitizers, and so on. We've invested in buying IPC materials also for all the health centers, IPC infection prevention and control materials for all the health centers in our project areas, so that also the health workers are safe. We suggested to our health workers that when they go and do outreach in the community, they don't enter the house. They stand outside with a family in like a semicircle, and they talk to the families, they talk to the community, and in those means, by making sure that they have masks, they have hand sanitizers. They understand the risks and also how they can prevent them, and they make sure to talk to small groups outside not an enclosed area. We maintain their safety. Again, be very happy to share any materials that we have. And also, we've created a manual for health workers, created trainings that are done again in small groups for community health workers to keep them safe. Very happy to share this with any of you if you want it as well.
Great, thank you very much, Michal. I found it very interesting and very useful. Thank you all for staying with us all the way till the end, and you're again more than welcome to stay with us also during the next lectures. In June we will have 3 more lectures, always Thursday at the same time, 3 o'clock Israeli time. The next one is going to be about water management in times of crisis. It's a lecture that we already had actually, and it was very, very successful. Not everybody managed to get through and listen to it. So we will, since it's very relevant, we will ask Mr. Lacker to give it again next week. And then in a sense, we will start in a more orderly fashion with a lecture about water management, the Israeli model. We'll have a Professor Ilona Dar, that will talk about it, and in a sense will try to give you a good picture of what it means to deal with water issues in a holistic way, of thinking about everything actually, not just dealing with one aspect of the issue or of the problem in many ways. And then we will start by going step by step from what's easier to do, what can be done in a more immediate way and in a cheaper way in order to solve the water problems. So the next, the 4th lecture this month will deal with actually kind of training and explaining and giving information to the public regarding the best practices of how to use water resources wisely. And then we'll continue on and on. And if you have already water in the pipes, what can be done in order to not to lose them? Just one example, in London, for example, 40% of the water that reaches the tubes in London is going away because of leaks and other things. In Israel, the average is 9%. In some places in Israel, it's 5%. So there's a lot that can be done, and very cheaply. And then we'll continue on, and I really hope that at the end we will have a kind of a library that will deal with most of the issues that are important for all of us regarding water management. And moreover, I really hope that even after that we will continue to be in contact. And here at the MATC, this is their job actually. So you're more than welcome to bombard them and ask them questions, and they will make sure that you get the answers. And of course, please invite your friends as well to the other lectures, so that we will do our small share in spreading information that might help other people all around the world. So thank you very, very much, and hope to see you all next week.
Bye-bye.
Bye-bye.
Thank you.